What is LIS, low income subsidy, and how it works? Are your prescription drug costs eating away at your retirement budget? If you're on Medicare, you may qualify for Extra Help, officially called the Low Income Subsidy or LIS, and it could save you thousands each year. In today's video, I'll explain what LIS is, who qualifies, how much you can save, and how to apply. What is LIS? The Low Income Subsidy, also known as Extra Help, is a Medicare program for people with limited income and resources. It helps pay for your Part D prescription drug costs, including premiums, deductibles, and co-payments. Helps pay Part D drug plan costs. Can reduce your premiums to zero. Cuts co-pays down to a few dollars, saves an average of $5,300 up to $6,200. Who qualifies for low income subsidy? There are two ways to qualify for LIS, automatic enrollment, or applying based on your income and assets. Automatic enrollment, if you, number one, have Medicaid. Number two, you get supplemental security income, SSI. Number three, you are in a Medicare savings program. Otherwise, in 2025, you may qualify if your income is the following. If single, $23,475 per year or less. Now, if you're married, $31,725 per year or less. In addition to income, there are limits on resources such as savings, investments, etc. If single, $17,600 or less. If you're married, $35,130 or less. Now, your home, car, and personal items don't count as resources. What does the low income subsidy cover? Here's how low income subsidy can help you save. Let's look at the benefits for both full low income subsidy and the partial low income subsidy. For full subsidy, your Part D premium will be no cost. For a partial subsidy, your Part D premium will be reduced to a lower amount. Now for deductibles. For those with full subsidy, you pay zero. For those with a partial subsidy, you'll pay a reduced amount. Next up, copays. When it comes to copays, full subsidy beneficiaries pay $4.90 for generic medications. And brand names meds are $12.15. If you have a partial subsidy, your generic and brand medications are at a reduced amount. Lastly, out-of-pocket cap. For your prescription, out-of-pocket cap for both generic and brand medications are $2,000. Once you reach the $2,000 annual out-of-pocket limit, you pay zero for covered drugs for the rest of the year. Now, let's look at the extra perks. With LIS, you also get no Part D late enrollment penalty. With a special enrollment period, you can switch plans once every quarter during the first 9 months of the year. Automatic re-enrollment each year if you still qualify. How to apply? Applying is simple. Online at ssa.gov/extrahelp. By phone, call Social Security at 1-800-772-1213. In person, visit your local Social Security office or apply through your state Medicaid office. They'll check if you qualify. Here's a tip. If you apply for a Medicare savings program, you'll be screened for LIS automatically. Let's take an example. Mary is 68, lives alone, and has $18,000 in annual income and $10,000 in savings. With full LIS, she pays zero for her Part D premium, has no deductible, pays $4.90 for generic and $12.15 for brand name drugs, and has no late penalties if she changes plans. If you're on Medicare and your income is limited, don't miss out on the low income subsidy. It's free to apply, and the savings can be life-changing. I'll put the application link and income and resource chart in the description below. Thanks for watching. If you found this helpful, hit like and subscribe to Freedom After 50. Also, share this with someone who might qualify for the low income subsidy. See you in the next video, where we'll talk about the Medicare savings programs and how they can lower your Medicare costs even more.